right now, the way that healthcare works, you have a medical record with your hospital, wherever you happen to go for the emergency department, and with your primary care provider, and hopefully they're in the same system, but maybe not. And then you have medical records where you used to live and maybe where you went to school, and just this wide range of places where your medical information exists. And frankly, you're not the middle of it in any of those places. You're one of thousands of patients with your hospital's system. You're one of thousands of patients for your primary care provider, and you're just not the middle of it. And so Guava is the one way that you are central to your medical information. And our healthcare is so complex. The whole concept that we are not central to our information is just mind-boggling. And so when it became clear to me that this was that Guava was going to be able to work with that and solve that, it was just really exciting. It just provides so many opportunities for ways in working with healthcare. So that's kind of where it started, is that recognition that this allows us to kind of turn healthcare inside out and make us, the patients, be the center of our information. When I have a patient come to me, so as a hospitalist right now, when I take care of patients, they're acutely ill enough to need to come and be inpatient for their medical care. So those are the patients I'm seeing right now. And they assume that we can see all of their medical records. They assume that we know that they went to the emergency department at the hospital, down the road. They assume that we can take a look at that X-ray, and it's just not true. And that same, my health system might be using Cerner, and that other health system might be using Epic, and there might be a third place that they've gotten their care that's also using Cerner, but it doesn't mean those two Cerner electronic health records are the same at all. They're each an individual version of it, and they don't actually even talk to each other. So accountable care organizations are working at trying to figure out how to warehouse data, but all of it is still really hospital-centric, billing and coding-centric, overarching population health, analysis-centric, and not for the patient. That Guava uses all the different patient portals with different providers to bring all the information into a single place. And then you, as the owner of your Guava record, it is HIPAA compliant, it's secure, but you have the ability to share that information with the provider as you see fit. So that's very helpful, because it means that if you, for example, go to see a specialist, you get referred to see a specialist. That specialist may or may not have all the information from your primary care or the labs, the X-rays, the MRI results, all of that. It may or may not be visible to that specialist. And so in this way, Guava can help you bring all that information to that appointment and make that appointment with that specialist much, much more effective.
And I know I mentioned earlier on in our conversation where Guava Health certainly serves people who have chronic health conditions or
Right.
multiple symptoms, things that are a little bit more significant, less than like somebody who might not really have anything going on. It might not be as beneficial, right? I mean, not that it wouldn't
Mm-hmm.
be, but it certainly would help somebody more. So, from your perspective, as being, a physician, coming from the clinician's perspective, being the
Mm-hmm.
CMO, how do you
Yep.
see Guava serving those types of people in a more meaningful way that makes their journey a little bit, hopefully a little bit more easier anyhow?
Yeah, yeah. Well, let me before I say that, let me just say that tell me one person who doesn't want to improve their health. I mean, really, even if you're healthy and really don't even
Right.
take any meds or anything, you still want to be healthy and continue.
Hmm.
So there are many, many ways in which guava can actually work really well for you as well. But it is a particularly useful tool for people who have a chronic disease.
So I'm assuming, I mean, this technology, does AI play a pretty big role in how Guava works, or is it really more of being this kind of central AI comes up like every interview that we do, so I figure I
It's
might as well
everywhere now.
mention it. Is that a part of it? Is it more just kind of being this kind of, I don't know, I feel like this nucleus, is that the right word? That guava kind of
Right.
sits at the middle and kind of pulls from everywhere.
Yes, yes, and yes. So Guava, it really is that hub that is pulling
Yep.
all the information in for sure, and not just from your medical record, but from your, your Apple Watch and your Fitbit and your Aura Ring, and your Dexcom blood glucose monitor, your Smart Scale, your Smart Blood Pressure cuff, all of that. So it really is the hub from all of those different kinds of devices, as well as your medical record. But yes, we do use AI in this in that for example, when I talked about setting up that visit prep, so we Guava pulls the information that's relevant from your medical history about the medications you're taking for that particular, when I said, you're going to go to the neurologist for a headache, for example, it'll pull in what are the relevant diagnoses you've had, relevant visits, and some of that history from your notes. So that, we do use some of that. We have what's called a Guava assistant who helps pull some of that together for you, so that you don't have to search through saying, I remember I got something somewhere. That's useless. Forget that. That's not going to be helpful. What's helpful is Guava being able to serve that up for you.
And also just kind of being ready for the unexpected, because like we've done
Mm,
a couple of really great interviews as part of our Human Stories series. And a lot of it was around like these kind of acute care situations where like you went from like normal to like, we don't know what the hell's going on anymore with me or
hmm.
my spouse or whoever. So and then you're just kind of spinning, right? At that point,
Right.
trying to figure out what's wrong. I'm thinking of Stacy Mead.
Oh yeah.
Yeah, and her husband's medical condition that kind of came out of the blue, right?
Hmm.
So where it is kind of aligned to this concept of like preventative care, right? Like kind of being
Hmm.
prepared for what might happen,
Hmm.
and
Hmm.
having these baselines, having kind of everything in the place before the crazy happens, right? Because it's something that's going to
Right.
happen, right? Like we can't avoid it. We're all going to run into some kind of unexpected, stressful medical healthcare situation at some point, whether it's you or the people you care for. So,
Right, absolutely. I mean, folks of a certain age are managing their parents' health and their kids' health at the same time,
mhm.
and being able to have eyes on that and have the information available for at your fingertips is huge.
Yeah, what a great tool for that.
Yeah.
I'm now thinking, I should be using Guava.
Yeah.
Yeah.
The longer this conversation goes, the more Heather's getting talked into something here. This has been a Shut Up production.
Shut up!